Thank you. I was looking at my little time here. It says 10:59, so I wanted to give people the extra minute, but I
Okay,
certainly we're almost there. To my time. Good morning, everyone, and happy Social Work Month. My name is Dr. Monique Constance Huggins, and I'm the undergrad program director here in the Department of Social Work. Let me welcome you to another RAP session. And RAP really stands for Research and Practice. And what it is, it's a speaker series that creates that intellectual space for us to talk about contemporary issues and contemporary approaches to practice. And I tell you, today's RAP session is no different. We do have a special speaker in the house, in the Zoom house with us. Over the years, RAP has served as a source of cultural events credit for our undergraduate students. And today's RAP is also a cultural event approved. And so I'm going to ask Alexis to talk a little bit about expectations for receiving cultural events credit. And this is specifically for our undergraduate students.
Everyone. Thank you, Dr. Huggins. To receive credit for the cultural event, the Cultural Events Office does ask that you have your cameras on at all times. And we will be shifting through and looking through all the people, and they have asked us to record names of people who do not have their cameras on and turn them into the office. So we're just trying to follow their rules and be respectful of that. And please let us know if anything's wrong with your camera, if we can help you in any way. And I hope you all enjoy it. Thanks, guys.
Thank you very much, Alexis. RAP is a department-wide sponsored event, and right now I would like to invite Dr. Hill, who is our graduate director and chair of the department, to talk more about the department's partnership for this particular RAP session, and as well to introduce our esteemed speaker for today. So again, welcome. Thank you so much for coming. And I know that you're all in for a fantastic treat. Dr. Hill?
thank you, Dr. Huggins. Hi, everyone. I'm Dr. Anthony Hill, a chair and graduate program director of the social work department here at Winthrop. We've been partnering with the South Carolina chapter of NASW since June 2020 to put on a series of webinars that focused on the intersectionality of racism during the pandemic. And that was a wildly popular series. And we decided to continue this partnership for Social Work Month. And so I have the pleasure to introduce my friend, my sister, my mentor, my everything I want to be when I grow up person, Dr. Mitt Joyner. Uh, Mitt is the president of the National Association of Social Workers that has 55 chapters throughout the United States and the territories. When she became president of NASW, she reached a trifecta. And what does that mean? She has served as the president of the Council of Social Work Education, as well as the president of the Association of Baccalaureate Social Work Program Directors, and now the NASW president. That is a huge accomplishment in and of itself. Mitt also serves as president of the North American region of International Federation of Social Workers, which includes Canada, the United States, and is a member of their executive committee. She serves on the boards of the NASW Foundation and the NASW Assurance Services, Inc. Her other board service include a community bank, where she was the first female and only African American to serve in the capacity, as well as the Chester County Food Bank. Professor Joyner received her BSW from Central State University in Wilberforce, Ohio, and her MSW in Planning, Policy, and Administration from the esteemed Howard University School of Social Work in Washington, D.C. Her professional career began at Chester County Children, Youth, and Families as a protective social worker. After graduate school, she became the first department head and legal liaison for child abuse for the Child Abuse Unit at the Chester County Children, Youth, and Families. In 2011, Professor Joyner, a full professor of social work, received emeritus rank with full rights and privileges from Westchester University of Pennsylvania. She is the recipient of numerous awards, including the BPD Gerontology Leadership Award for stellar national leadership in the field of gerontology, the BPD Lifetime Achievement Award, I'm losing my breath a bit. Goodness gracious, losing Living Beyond Breast Cancer Founders Award for Lifetime and Stewardship, the very first Dr. Annabelle Burns Lindsay Award from the Howard University School of Social Work, the Central States University Hall of Fame Award as a distinguished alumni, the first uh, William Cup Lecturer by Abilene Christian University School of Social Work, and the CSWE Lifetime Services and Leadership Award. In September 2019, Mitt received the prestigious NASW of Pennsylvania Phyllis Black Lifetime Achievement Award for her leadership and commitment to social justice and the quest for obtaining equality for all. Professor Joyner is married to the Honorable J. Curtis Joyner, a senior federal judge of the Eastern District of Pennsylvania. Together, they have three daughters: Dr. Jennifer Joyner Hall, a clinical psychologist in Washington, D.C., Nicole M. Joyner, a human resources director in Atlanta, Georgia, and Jacqueline A. Joyner, an attorney in Washington, D.C. Her greatest role is being Gigi to her lovely grandchildren. You used to see these boys, they're the cutest thing. Her two lovely grandsons, David Anthony Hall IV and Jacob James Joyner Hall, who are the reasons she remains committed to the arduous task of working to achieve social, racial, economic, environmental, and political justice for all. Welcome to South Carolina, Dr. Mitt Joyner, my friend.
Listen, thank you. Thank you for that great introduction. I take one exception, Dr. Hill, my sister, my mother, he's making me feel like I'm ancient, and I am. So I want to let you know that Dr. Hill is someone that I greatly admire, and that he has numbers that nobody else has. So I want to thank. I remember when he was talking about coming down and accepting this position, and I was kind of like, oh, this would be great for you. But then I was kind of like, oh, but you're going to be leaving the DC area. So every time I go to DC, we usually could get together and eat. Do I really want to do that? But I shared him with you. And I see that he has just excelled in doing exactly what I knew he could do. So I make him promise me that once we turn the switch to being able to travel, and by the way, I am vaccinated. I am able to travel now, that I get down there to visit all of you all. I also want you to know that I served with Dr. Hill on the national board when I was vice president of NASW. So he carries with it our vision, and I know that all of you understand that vision and are moving forward. And I want to recognize Juliana, the ED of NASW, because we want all of you to be lifetime members of NASW. And I hope to be able to talk to you a little bit about that today. So when we were putting this together, I decided that I really didn't want to do a presentation with a whole lot of PowerPoints. And I didn't really want to bore you with myself. Really, what I wanted to do is to hear from you. So we are going to take a lot of questions after I give you a little bit of overview about myself and the vision of NASW, and then we'll talk, right? Because this is a chat, and I need to know what you need as your NASW representative, so I can make sure that we're meeting your needs, because that's what your association does. Happy Social Work Month, everybody. We have to say that. Not too often do we take our time to pat ourselves on the back. So I just like all of you to take your hand, pat yourself on the back, right? Because you are deserving of that applause. You do things that other people really do not do. if you help one person, you've probably done more than the average citizen. So I wanted you to do that. Now, yesterday I had a health scare. So the reason why my hair is all over my eye is not because I'm trying to be, as I told Dr. Hill, extremely sexy or anything. It is because yesterday a blood vessel broke in my eye. I don't
Oh,
know if it's too many Zoom calls, too much light, but my eye is red. I mean, literally red. And I thought it would this morning when I woke up, I thought it would be better. And I asked my husband to look at it, and he just looked at it and said, "Have a nice day." So, in other words, it's not any better, right? Because I told him, don't make me feel as if it's not better. So, it happens. We have all these lights around us to try to lighten up the place. And I think that being on Zoom all the time is now starting to take its toll on my old eyes, as Dr. Hill said. Um, so let's talk about social work, and let's talk about where you are, and let's talk about the passion of why you came into this profession. And it is important for you to write down why you came into social work and to look at that every year, because as you move on, you'll forget about that unless you remind yourself of the passion that you have. Now, I came into social work really when I was before I even went to school. My mother made all of her children work and try to figure out what's your purpose in life. So I guess I wasn't moving too quickly, so she made me volunteer at a hospital where I was a candy striper. I hated it. I knew that I didn't want to be I did not want to work in a hospital. And I didn't hate it because I just did not like hospitals. One day I was working in the ER room as this candy striper, and in walks a woman with a white coat. Why I like white coats today. And she said, the doctors go here, the family members go here, the child goes here, and the person who hit the child goes here. And all of a sudden I saw everyone doing what this person was saying. And so, to fill in the backstory, there was a horrific accident. A child was hit by the car when they were riding the bike. They knew that the child was not going to make it before they even reached the hospital. And it
mm,
was important for everyone to be, as we say, partialize the problem, where the parents were in one room, the person that hit the car was in another room, the family members were in another room, and the child was escorted in another room. And while the hospital staff worked on the child and then came out and delivered the horrific news that they knew that they were going to have to deliver. So I said to one of the nurses, "Who is that person?" And that nurse said, "Oh, that's Janet Robinson, the social worker." Now, I thought she said society worker, because I really wasn't paying attention. So I said, "Oh, wow." I ran home that night and I said, "Mom, I know what I want to do with my life. I want to be a society worker." Mother looked at me, "A society worker?" And I'm like, "Yeah, there's this woman at the hospital. Her name is Janet Robinson. And that's what she does. And I want to do exactly what she does." And she said, "Oh, I know. I live in a small town. I know the Robinsons. In fact, her mom is your sister's Girl Scout leader. And that's Janet Robinson. And she is a social worker." And I said, "Well, that's what I want to be." Well, Janet Robinson, unless she's heard me speak about this, I never walked up to her. I never told her. I never said a word to her. That she impacted my life that day. And I knew that I would want to be a social worker. And I went off to a BSW program that had a BSW degree and then an
mhm,
MSW degree. So you never know who's watching. And you never know who's sitting back watching you, the social worker, deliver services. And she delivered it in such a way where she didn't get all frazzled. She didn't say, "Oh my God, what am I going to do?" She just directed everyone. And everyone listened, and it was going to have horrible, horrible outcomes. A child's life was taken away from them. But she didn't get caught up in that. She got caught up in how she could serve all of those groups. And what where the empathy that I saw the most is that she also, the person that hit the child, she also provided support for that person. She didn't judge. And I knew that I wanted to be a social worker. So from that day on, I went off and I went into Ohio and I worked in Ohio and did my placements out in Ohio. I came back and as Dr. Hill said, I worked at children and youth. I worked in protective services, and I realized that the system is really made up of people. And so often when people talk about systems, they don't talk about systems are made up of people. And so as we were looking at protective service, there was this rule where kids who went into care weren't allowed to see their parents for the first 30 days. And they called it the honeymoon period. They wanted the kids to adjust to the foster home. So, you know what? We're not going to let them see their parents. I thought that was one of the most bizarre rules. So I went to my little corner of the world and I said to my supervisor, "Can you imagine not seeing your parents for 30 days, not knowing what happened, just being pulled out of your house, not knowing where they are, how they are, why you were pulled? You're going to begin to think that you were the problem. This is not right. We should not have this rule." And of course, I was just a little freshly out of the school, and you know how people will always say, "Oh, that's what students think." She said, "Go do your research." Well, the one thing you're going to learn in your program is the research can help you find the data that you need. And I found all this data on separation and on trauma and what it was. So at the next monthly meeting, that they had of the agency, when they said, "Does anybody have any questions?" I raised my hand and gave my report. And my report was on the trauma that this would have on kids and that kids should see their parents the very next day. And in fact, I gave data to the fact that the longer that kids stayed out of the care, the more likely that they would be in care for a long period of time. And therefore, we were going against our mission because the mission of child welfare is to reunite families and children, right? So the rule got changed. And that began to show me, wow, data matters, research matters, and speaking up matters, even when your voice quivers. It matters because I was scared to death standing up there saying something, afraid people were going to tear it apart. My voice was quivering, but change occurred. And so that's why I don't even get into this big drama that goes on into social work about the micro, the meso, and the macro. Because whether you work at the micro, you impact that meso, that was the agency, and you impact that macro. And whether you are a supervisor in an agency working in the meso, you impact that micro and that macro. Or whether you are a head of DHS, the policies and practices that you have really kind of impact the meso and the micro. So what I say to all of you all in social work is you are a cord where all three of those things are wrapped together. And you need to understand how to actually change the system, which I said earlier is made up of people. And if the system doesn't change, you get the people out of there, right? And that's what my education at Howard taught me. It taught me the strengths-based perspective that no matter who you work with, everybody, everybody has strengths. Just talk to people. Everybody has goals. Sure enough, they may have had some difficult times, but what you need to do and what we're taught to do is to be our own abolitionists. We are our own Harriet Tubmans, right? We are supposed to be helping people navigate a system so we don't even they don't even need us anymore. That's the purpose of social work. It is not to have people come see us every week and for us to tell them do a little bit here and a little bit there. It's for us to give people the skills to be able to navigate the various systems. My story at Howard, and then I'll start taking some questions, was when I was in the School of Social Work. It was a time when students were allowed to have food stamps. So, of course, I was going to sign up for food stamps. And what the office was down the street from my house. And you had to get up early in the morning because the office was notorious for only taking like 50 people a day. And so you'd see people stand in line. So I got up, went, and I was think I was the number fourth person in line. Well, ahead of me was an older adult. Her legs were swollen. She had a paper bag full of papers, right? And we just stood there and kind of talked. The thing that I always remember until this day is I watched the social workers get their cup of coffee and eat their donut while people stood outside in line. I just thought that was so cold. Why couldn't we go inside and sit in the reception area? But that's the way the system worked at that time. Sure enough, at 9 o'clock, someone came out and opened the doors, and then you were allowed in the vestibule and they handed people papers to fill out. So as I sat there and I filled out my paper, which was name, it was on, all the data, this lady with the bag just stood there with her paper. And then she said to the person, "Excuse me, I can't read." And you could see that she was mustering up to be able to tell someone that she couldn't read. It was embarrassing to her. And the social worker there said, "Excuse me?" And she said, "I can't read." Again, she had to say it. And the woman said, "You can't read?" And she said, "No." Well, then you needed to bring somebody with you to fill out these papers. And she looked and she said, "Well, I didn't, but I do have all my papers here with me." And that was what was in that paper. I have all of my rent receipts, all of my papers. The social worker at the time said, "Well, we don't fill those out. You have to have someone here to fill them out." Now, because I am a nosy person, and again, I'm listening, I jumped up and said, "Give me your paper. I'll fill it out." And I dug down in there and started filling out name, rank, and all of the stuff. All of a sudden, here comes someone out who I guess was either the supervisor or the director, I'm not sure who. And they pulled me out of line and said, "We'd like to speak with you. Can you come inside?" And I went inside and they're like, "Who are you?" And I told them my name. "And are you related to the lady?" And I'm like, "No." "Do you know the lady?" "No." "Did you come here with the lady?" "No." "Well, then you cannot fill out her paperwork." And I looked at that woman because I told you food stamps didn't matter to me that much. It was the system. And I said, "You know who I am? My name is," at that time I wasn't married, Mitt Carter, and I am studying social work at the Howard University School of Social Work. And you know what? When I graduate, I'm going to come back and take your job so that you never treat people like this again. And the person looked at me and I said, "We have a code of ethics, dignity, and respect." And you you sat out, so we had to stand outside. And I went through my little tirade. Well, they processed me for food stamps. They processed the lady to get us out of there because I guess they thought that I would go back to Howard and we'd have this great, because it was protest time now, it was the early 70s, they didn't want to sit in. So they didn't know what I was going to do. They got me out of there. But it let me know again that we have to speak up, not for the voice of the voiceless, but for the voice of the people that rarely get heard. That is the role of social work. So as we're fast forwarding here today, our country is teetering. I mean, teetering. We have in our nation, we just passed the COVID bill yesterday that's going to be signed today. That will be the largest bill in history, in American history. Kids, those who are at the bottom rung of our social and economic status, they will have now their own social security. They will receive a check each month for $200 or $300 per child so that they don't have to live in poverty. This needs to be applauded. In this country, there are two demographics who do not work: older adults, why we have Social Security, and young kids. And we cannot in this country any longer say that kids are going to fall through the gaps. We know that childcare is expensive. We know that food is expensive. We know in our country every year we shut down the school system in the summer, and parents have to try to figure out who's going to watch my kids in the summer. And they got to pay, and it costs money. And we know that we have people that do jobs and get paid under the table because they'll get penalized. Finally, in these United States of America, we're going to change that. But don't get it twisted. There are a lot of people who do not like the bill that's going to be signed into law. We have now over 41 states that have proposed legislation at their state houses to suppress the right to vote. We are back to the Jim Crow days, where when you used to register to vote, they would tell brown and black people, do an algebra problem. And if you couldn't do the algebra problem, you were not eligible to vote. We're back to the Mississippi Summer Project, when liberal students would get on buses and go through the South and register people to vote. We're back to those times. You are going to be our heroes and our sheroes, because you are going to be those young people that go out into the community that says this Constitution that we had guarantees that everyone, one vote, one person. Think about it. People are arguing that people should not have had the chance to drop their ballot in a box during a pandemic. During a pandemic, they wanted people to stand in line, especially in brown and black communities. Because if you look at and you go back and you look at where this is being impacted, it's when you go to Georgia, it's not those areas in Buckhead. It's those areas right in the center of Atlanta that are being targeted. So we do know that race equity matters. And we do know that we have to keep it at the center of everything that we do. And we do know I stand on the shoulders of Whitney Young, who was the president. He was the president of NASW just like me. He volunteered just like me. We don't get paid for all of this. And he actually was one that orchestrated and worked with Dr. Martin Luther King, A. Philip Randolph, John Lewis, and James Farmer for the March on Washington. In fact, if you go and you look at some of the tapes, he was the one that spoke prior to Dr. King. And he worked with President Kennedy, President Nixon, and also with Johnson, where the Voting Rights Act was signed. And now we have HR 1 and HR 4, which are the voting rights parable that are going to be, that was passed by the House, and now the Senate most likely will not pass because you need 60. And unless the president uses his last time where you only need 50, those 41 states, some states where there were no voting irregularities, will teeter our democracy. So we've got work to do, social workers. And what can you do is what we're going to be discussing, because you have to be the voice of the community. You are there in South Carolina. You hear the issues. Now, what we have to do is we have to address to that group that gets those kids are going to be able to have their own Social Security. We have to let people know how that act will impact their lives for generations to come. But we also have COVID. And we know that race equity, the virus really doesn't hit the blood of people based on their race, but we do know that the distribution does. We also have economic injustice. More women lost their jobs this year than in any time in history. And now we've got to get them back to work. We also know
Mhm.
that our schools were shut and kids are going to be going back to school. Some of them have never ever clicked on and did their lessons, and it's not their fault. Some kids had to sit outside a Taco Bell to get Wi Fi, but now they're
Many
going
and
back. We can't let those kids also go back and then get shut down because schools generally close down around May. We must ask our government to consider a bill and ask our local areas, the school boards, our states, and our nation to have year-round school for the next 3 years. We have to do drastic things. I, as Dr. Hill said, set on a food bank. We have people accessing food banks that never asked for help before. Social workers, you will definitely be in need of service. The mental health of America will reveal itself in a few more months. We already see that the George Floyd hearing has started, and we don't know where that's going. But I don't know if the outcome is one that we all think is going to happen. And then what happens if it doesn't? So I want you to write your passion on a card, and I want you to think about how do you want to be a change agent? And I want you to remember, even when your voice quivers, speak up. Thank you. So let's just talk now.
So I'm asking participants, please write your questions in the chat box. But while participants are doing that, Mitt, there were some questions that came in earlier, so I'll ask those. President Joyner, in December 2020 to January 2021, Social Work Advocates publication, you wrote an impassioned piece entitled, "We Must Examine American Soul to Address Injustices." A main premise was if democracy is to survive, social work must examine the real soul of America and that our profession should lead the moral movement. I'm curious about any action steps taken or planned to operationalize this aspiration.
Excellent question. In fact, I have a call this afternoon on voter engagement of social workers. We have to do, I believe in community. I believe that every one of you have the power to go into your community. I believe that, wow, you all can have a town hall meeting with your community, right? Not with social workers, but with your community to begin to address the next who you're voting for, to address some of the issues, to actually go through this COVID bill and let the community know some of the benefits that they'll be receiving in a few months. We know that the checks will be going out soon, but it's not just checks. We know that the restaurants are going to receive money. But we have learned that this platform called Zoom reaches people, and it's time for social work to go out and work in their communities. So that is what we're going to be pushing. We'll be doing other things as well. We'll be having campaigns, but we're going to be asking every NASW chapter to really think about how they're going to get out the vote and organize the social workers in their community to do so. Way back in the 70s, they had these things called coffee clatches where people just came together and talked about voting. We can see the power of voting. I mean, look at Stacey Abrams. Stacey Abrams did something that even I said, nah, she's not going to be able to do all of that now. We're putting too much on Stacey's shoulders. I mean, she turned a red state blue. And I hate using red and blue, but she made people realize that you have the right to vote. And she went out and made sure that everybody was registered. And she just did not register Democrats. She registered anybody, right? She went to the hair salons, to the nail salons. She went to the drugstores, to the churches. She went to the community. See, you can't ask people to sit back and vote and not touch them. You've got to get out and walk those streets and let people know. Stacey Abrams did it. And then as soon as she did that, what did we ask Stacey Abrams to do? We asked her, you know what? You got to bring home 2 senators for us. Now, I know, we get all those calls, send money in, send money in. And I was sending money in, and I'm like, this is not going to go anywhere because there's no way that she's going to be able to bring in 2 senators to balance power. But you know what? Stacey Abrams doesn't listen. She sets her eyes on. She's a problem solver. That's what you are. She identifies the problem, she partializes the problem, and then she goes out and works on each one of those. And what did she do? Darn it. She brought 2 senators. Not one, but 2 senators. Now, if Stacey Abrams, and I just was listening to her last night, she was just talking about we got a big job to do. They're trying to repeal things. But when people repeal things, they forget the resiliency of people. When you try to take away things, they're like, nah, you're not going to do that. And we just need to be mobilized to catch that, to say, do you understand that in Georgia now, they're trying to pass a bill that says that if you're standing in line for 4, 6, 8 hours, nobody's allowed to bring you food or water. Nobody's allowed to bring you food. How can you stand? Just imagine your grandmother, your mother, yourself standing in line, waiting to exercise the right to vote. Nobody knows whether you're going to vote, who you're going to vote for. Nobody's allowed to bring you water or food. See, that stroll to the poll when they organized in Georgia, the stroll to the poll, when the HBCUs and all the colleges and all the universities came together and they had marching bands and they were entertaining people and they were making voting fun and they were having food. They didn't say if you're not going to vote for Biden, you can't have food. No, they didn't say that. But today, and you go and you look it up, they want to deny people. And you have to begin to answer why. Because voting means power, right? And people do not want our people to have power. They want that power in the hands of a collective small group of people. And that's not a democracy. We know that Hitler did the same exact thing. And we saw the destruction of what an autocrat or what a dictator does. And we saw that on January the 6th as well. If they had found Nancy Pelosi or Mike Pence, they would have hung outside our Capitol and our democracy would have been gone. And there was milliseconds where that could have happened. The question that I asked, and I know Dr. Hill's been in Washington many times as we go to NASW meetings, how does someone erect a guillotine in front of the Capitol? I mean, you can't walk across the Capitol grounds and drop paper without somebody saying, pick up that paper. How does someone erect a guillotine? And we can pretend all we want. We know that the evidence points to that there were some very powerful people making sure that that insurrection occurred. And we have to call it out. We have to name it. It can't just be brown and black people. We need everybody to say this is not America. And this is not the America we will stand for. So NASW will do that. Whether we have a call and we're thinking about, and it all depends on, again, COVID, whether we have our own March on Washington prior to the election in 22. That's what we're gearing up for social workers to come together, not only themselves, but their coalitions, the people that they serve, and begin to show that the people will not allow our democracy to teeter.
Thank you, Mitt. This question, the individual thanks you for your time and sharing your expertise. He greatly values his membership in NASW and intends to maintain his membership over the course of the career. However, I'm curious, and the author says, I'm curious, in a country of more than 700,000 professional social workers. Why is the membership of NASW around 130,000 members? And why is the membership in our professional association shrinking?
Yeah, that is a wonderful question. It goes back to what is the purpose of my membership, right? And people begin to ask that question. And I go with the JFK quote: don't ask what your membership can do for you, ask what you can do for your membership. We are a professional association that represents you. So when you say, Joyner, we want you to speak out on this, or Joyner, you want you to speak out on this, or go to the Hill and push this, that's what I do. And your state NASW office does the same exact thing. Um, I think people get it twisted about what membership is all about. I do know that when I go to a senator's office, or go to the House office, and Anthony, you went, the first thing they ask is, how many people do you represent? That's the first question. And when you say 130,000, you got their attention a little bit. Okay. And is there anything in my area? And when we can say, yes, we have an NASW chapter in every state, and we have divisions all over your state, we get people's attention. Now, you may want to ask, how does law do it? How does doctors do it? How do they get legislation pushed through? They get it pushed through by their numbers. They get it pushed through by their representation. How do they get amendments on there? They get it pushed through because they lobby and they push things. Last night, we were marking up the George Floyd bill. What is it that we want to see in the George Floyd bill? And what we just recommended was, every one of those task force and panels, we want a social worker at the table. So we put that in. And Friday, there'll be a call with Karen Bass, Representative Bass, who's the sponsor. And that's what we're asking to be included in that legislation. So we have, and that's what we do on federal level. What Juliana does is, that's what she does in your state on the state level. And so it is important for us to rise into the membership. You know, the one thing that I'm going to tell you is, as long as you have breath in your body and you graduate as a social worker, use your acronyms. Don't take on some other acronyms, because use that you are a BSW, that you're an MSW, or that you have your PhD or DSW. Let people use your LSW or your LCSW. Let people know your professional affiliation. And then volunteer. Now, I cannot be naive to say that NASW has done everything that we should do. We just kind of moved into making sure that you have automatic renewal. You know, I always used to say, why do I have to write a check every year to NASW? I don't want to do that. You know, just charge me. Just do it like YouTube, all the other stuff. iTunes is charging me for stuff that I don't even know that I'm getting. So do the same thing. And so we moved into that. And then we're kind of looking at whether we should have it where we have installment plans. Now, according to accounting principles, you cannot count revenue unless you have all the revenue in. So for us to kind of do that, to say that you pay 1/10, 1/10, 1/10, or 1/12, we've got to pay the whole year forward. So it's going to cost us an investment of a little over $5 million to do that. So whether or not we should kind of roll that out, um, with offering it to different levels, is something that we're studying right now. And I also think that NASW needs to do a good job at a timeline. What do you get for your membership at each year, right? So, you know, younger people, and I ask you all to make the March 22nd a day that you mark down. We are literally going to have a conference. It's called the International Federation of Social Workers, but it's called Ubuntu. Ubuntu is the word that an international word that IFSW came up with. It means I am because we are. It goes back to Mandela and Desmond Tutu's message. Whoever I am, it's because who our community is, right? And that's what we are touting. Well, on the 22nd, we are sponsoring 4 students and entry-level social workers at 1 o'clock East Coast time for 2 hours, just a marathon. on welcome to the profession, what you get for the profession, and those kind of things. So we have to do better job at bringing people in, at maintaining people who've been there for 5 to 10 years, and then people like myself, we want travel trips. I want to be able to go to Alabama and see the work of Brian Stevenson and talk with like-minded social workers about what we did. We kind of sponsored something like that, not we, but I tried it because I don't believe in trying to push something that I haven't done myself. So a few years ago, I brought 100 people to Martha's Vineyard, where we just came together as social workers to talk about where we are and where we want to go and how we're going to be a change agent, and to do the thing that I think is most important that everybody do: write down some deliverables. Don't talk about where you want to be 50 years from now. Talk about what you're going to do this year, and then come back and tell us what you've done. So we need to do more things like that.
Thank you, Mick. So this person asked, if you were able to pick one, what would you say is the number one grand challenge in our country for us to address?
Racism is the human stain of America. Since 1619, racism has been the human stain of America. It's like putting on a shirt and there's a stain on it, and no one says there's a stain on that shirt. We have to talk about race. Remember that when people of color came here, they were not allowed to read or write. So our institutions were never made for people of color. It was always a thing. Frederick Douglass, who never ever went to school or education, was a self-learned man because institutions didn't accept us. And if as a slave you learned how to read or write, you were killed for it. So we know that the system is not for us. But we also know that Latino people who were living in Florida and California and Texas through the strike of the pen at the ending of the Mexican-American War, the country was no longer theirs. They were a United States. And the pact and the agreement and the treaty that we entered was that we would each learn each other's language. But we only pushed for those people in Texas and California and parts of Florida and all those states that belong to Mexico. They had to learn English. We also know that there were over 493 different tribes here in the US that were Native Americans. They went under different names. We named them Native Americans. But they were indigenous tribes. And we still, on our history books, talk about how Columbus discovered America when there were thousands of people here before, but we don't recognize them. And we have pushed them back to reservations. And a reservation means that it's not their land. The reservation means that when the very last Native American dies, that land comes back to the United States. And if you've ever been to a reservation, they do not have water, they do not have electricity. So it is no surprise why COVID ran through and killed Navajos like ever before and almost making them extinct. And we also know that we brought Chinese people here to build the railroad. But we had what we call Chinese Exclusion Act, where they could not be citizens of these United States, where they were not allowed to learn to read or write. And then finally, we broke that. We know that there's an Executive Order 9066 that during the war gathered up all Japanese Americans and sympathizers and hurdled them and put them on trains and put them in 13 different states because they were Japanese Americans. Even though there were some of those that went off and fought for the United States. And we know that we put Native Americans in these schools, boarding schools, chopped their hair, had them take their language away. And then let's get back to African Americans. We know we have made a hurdle for African Americans at every point that we can. We know that the right to vote for people only occurred because white women demanded that they have the right to vote because they were getting ready to give that right to vote to Black men. And white women were saying, you can't do that. So again, when we talk about the vote and the power, just think about that. If we wanted racism to stop tomorrow, we could do it. We could just say, let's vote that in. that we will not allow that to happen, because women would have never had the right to vote if it wasn't for men. And racism can never be really totally disappear unless white people decide it's not worth it anymore and goes to the ballot box. And that's why you have Proud Boys, and that's why you have what's happening in the United States. So the number one problem, the existing problem, is that we have got to talk this out. We have got to talk it out and understand that I am no better than you, but you are no better than me. And everyone has the right to have an opportunity to excel. Just think about it. Diversity is our strongest point in the United States. If we came together and we worked together, it's like pouring water in a bathtub. We all rise. Not, we won't leave one side down. We all rise up and do better. But I'm afraid, unless we talk about it and go into those communities and we say to people, we're all equal. I have an epidermis on my skin that is brown. That's all it is an epidermis. But you go underneath that, my heart pumps like yours, my blood goes through like yours. We're all the same. And that's what social workers have to do. We cannot pretend that racism doesn't exist. And we have to do the work of race equity and gender equity and economic equity and age equity and all of those isms. That's what we are supposed to do.
Thank you for that, Mitt. Mark says he's a BSW undergraduate student and he would like to know, why is the content concerning social work so edited to show the mild side of issues of poverty, abuse, and social justice? I think we as students need to see the real side of the issues that comes with the profession.
Yes, the Council on Social Work Education is the sole accrediting body of all social work curriculum. And I know that they are right now looking and re-examining and reimagining what the curriculum should look like. Look, this last year has made every association, every group look at itself, because everybody kind of just fell into, let's just do things the way they were done. And then as we watched people murdered, and we watch the disparities. And I tend to say that disparities is a dress up word for racism, sexism, ageism, classism, right? You know, you have a disparity because some group is being left out. And that's all it is. So every group is reimagining themselves. Now, but what we have to do is we have to stop just listening. We've got to take action. And sometimes social work is so purposeful. We you have a meeting, and then you have another meeting, and then you have another meeting, and you have another meeting to decide what you're going to do. We have to learn that risk taking is a part of social work. Just like when I said at the very beginning that social worker came in that ER room and said, you're to go here, you're to go here. They didn't worry about whether people felt that their power had too much power. Doctors head up those hospitals. Doctor didn't come up to her and say, I'll make those determinations. She risked and did her job. And we have to do the same thing. We have to risk to be the voice of the persons that very rarely get heard. Clinical social work has become something that I think even in our profession is a good thing. I mean, don't get me wrong. People like to hang out their shingle, and they like for clients to see them, and that's a good thing. But a clinician has a responsibility to work for all people, not just people who can afford to pay for their services. So, and we cannot adjust all of our rules for a clinician. A clinician in social work has pledged themselves to the code of ethics. And what I ask you to do every year, read your code of ethics, not one little piece that pertains to you, but the entire code of ethics, because that's the principle on which we stand. And you can have your personal beliefs. Don't get me wrong. You can say that I don't believe in this or that, and I don't want my family to participate, or I always use the example because I was raised Roman Catholic. Maybe I don't want my kids to have an abortion. But I'm going to tell you, if someone comes to me as a client or a consumer and asks, where can I get those services? It is not up to me to determine what they should do. I'm going to give them that information. That decision is up to every individual person. That's what freedom means. It's not Mitt Joyner's story, it's their story.
Thank you, Mitt. Hannah wants to know, do you have recommendations for books to learn more about the intersection of racism and social work?
If I just turned around, I could just show you my whole entire library because I was race relations was my area of expertise. There are a lot of books. There's Joy DeGrew's book, kind of looking at post-traumatic slavery here. This is a good book, but I think Stud Terkel's book is good. There are so many, and I'll be glad to send some to Dr. Hill, but you can also go on socialworkers.org and look up, and they have a lot of information there. Um, what I say when you're studying race is, and what I used to tell my students, it's important to be willing to listen. You know, I do know that our history, every group contributed to this nation. And so I know when I say about Christopher Columbus, I know some people get like, wow, you're trying to take Christopher Columbus. I don't believe in that cancel culture type thing. I don't even know where that word came from. What I do know is that every one of you are trained to go to the primary sources. So I would always tell my students, no matter what I say, don't write it down in that book until you check out that it's fact. Go to the library. When I talk about Trail of Tears and the fact that we moved Native Americans from Florida all the way out to Oklahoma, many people died, but many people also lived with the slaves, and why African Americans and Native Americans, why there's a crossover there. And there was another time at the end of Emancipation Proclamation when African Americans walked up to Chicago, they went right through the reservations, and many people merged together. There's reasons why things happen. Use your inquisitive mind to go back to the facts. Do not use YouTube. Do not use Wikipedia. Do not use all of those podcasts because people just say what's ever on their mind. And that's what's wrong with America right now. You know, I cannot imagine that last week we spent so much time talking about books, right? And talking about Dr. Seuss and talking about whether or not Mr. Potato Head, yo, we're in the midst of a pandemic. And you're going to talk about Dr. Seuss, books that Dr. Seuss's publisher said we don't want to have out there anymore. And you're going to make that where we spend a lot of time. I wrote to every newscaster, CNN, NBC, and yes, Fox. You're wasting people's time by talking about Mr. Potato Head and Dr. Seuss when we should be arguing about this COVID package we have going out. So see, we have to hold our people accountable. Take the time to write them, call them. Someone put in our local newspaper, I'm so sick of cancel culture. And I wrote, who and what is your definition of cancel culture? And of course, they didn't reply back because nobody knows. They just pick up things that they hear on the news. Truth and facts. That's what your education gives you. And so when your professors say, go back and find those primary sources, you're going to learn, I want the primary source on that.
We are at the
At a
2 minute
time.
mark. So I'm going to ask, I could listen to you forever, and I miss hearing you in person. But I'm going to ask Sylvia Rogers, president of the NASW chapter of South Carolina, to have final remarks.
Yes, hello. Thank you, Dr. Hill. And hello, everybody. And I want to say happy Social Work Month to all of you. I'm just elated to be here today. And I'm so happy that our national president, President Joyner, joined us virtually today. And it has been a great presentation and well, research and practice, the RAP program. This is my first time joining it. It is wonderful. I think it's a great cultural event for all of us, students and professionals, to learn a lot and just enhance our knowledge and skills. Sometimes we forget things, and it's good to be in a setting such as this to remember our history and remember some of the things that we get so busy every day from our day-to-day work and in social work. We're busy social workers, and we need to take this time to have this conversation about a lot of things that we take for granted and we forget about from day to day. I just want to tell you a little bit about me. I'm your current president for NASW South Carolina chapter, which was effective July of last year. It's a 2-year term. I'm glad to be here to serve you in this capacity. And I'm hoping that if you're not already a member, that you will become a member of our great chapter here in South Carolina by talking to one of us or going to our website, socialworkers.org or nasw.org, and becoming a member. And while I have your attention, I just want to say that we talked some about trauma to children and families. Well, social workers sometimes have trauma also, because we listen to the stories that others tell us, those trauma stories. So we are victims of secondary traumatic stress. And at this time, I'm presently in a dissertation program, in a doctoral program, doing a dissertation on secondary traumatic stress and undergraduate social work students, which has been in the research. There's not very much research on undergraduate social work students and compassion fatigue, but you are in the helping profession also when you're in field practice. So if anyone interested, any undergraduate social work students are interested in volunteering to be interviewed, just contact me. I can put my phone number in the chat, and Dr. Hill already has my recruitment letter, and it has been sent out. So if you're interested in participating, please see me. And again, I'm so happy to be here today in this platform with you all and meet you. And just know that Juliana, our interim ED, and myself, we are available to help you and answer your questions and whatever needs you may have in the state of South Carolina. And again, thank you, President Joyner, for being here with us. And we hope you will come back and see us soon.
Most definitely. Wouldn't want to be anyplace else. Let's just remember that there are 525,000 people who've been affected by COVID. Every one of us knows someone. Let's keep that number no higher, right? So thank you for your happy Social Work Month.
Thank you.
Celebrate yourself. Thank you, Anthony.
Thank you, my friend. Goodbye, everyone.